Hello again, everyone. Mark Macomb, Macomb County Executive, John Paul Ray, Deputy Executive. Just giving you an update what's going on with the COVID and kind of just an update for you. We're probably going to do this on Mondays and Fridays to make sure that, whatever's gone over the weekend, we can kind of give you some updates. And then throughout the week, we'll compile some of the interesting facts as well as statistics. But please understand, all this information is available on a regular, consistent basis at macombgov.org. All the facts and data that you need, just log on to our website and you'll get that. So where are we at? I know it's Friday here and we're still seeing some challenges, unfortunately some deaths as a result of this COVID, but it's starting to level off a little bit.
Yeah, Mark, we're starting to see the plateau right now. Just over 6,000 cases countywide right now, about 682 deaths, unfortunately. But however, the recovered numbers continue to rise as we're getting those reports in. Over 2,900 people officially have recovered from COVID in Macomb County. When we look at that statewide trend, Mark, about 45,000 cases statewide, and again, 4,300 deceased across the state of Michigan. I think what we've seen is the surge that happened here in southeast Michigan, a plateau. Other hot spots around the state start to peak up, whether it's in Kalamazoo or Kent County too. But again, a handle of it, a flattening or a plateau as we're seeing with our numbers. And again, just that strategic response as we begin the major push for contact tracing.
And I think that original goal has been met. And the original goal basically was to try to figure out how do we reduce the surge going into the hospitals. And there was excess capacity facilities that were put in place, TCF, as well as the Novi Center. And fortunately, based upon the fact that people were paying attention to CDC guidelines, the OSHA standards that are out there, making a determination that, we need to help be a part of the solution because they saw the numbers. They realized factually this is a concern. People abided by that. And so understanding that, it had a tremendous impact on lessening the curve and reducing the number of cases as well as the number of deaths.
Mark, undoubtedly the measures that have been put in place with the stay home, stay safe orders has definitely helped flatten the curve. The question is as we begin phasing in this economy, as we look at some of those industries that have started to open up and everything, how is it that can we continue to use that personal responsibility, use those social distancing measures, obviously bring in the whole notion of the facial coverings and what that means, not only in your workplace but in your day-to-day interactions. All those things become part of those common sense approaches that we've talked about throughout these videos.
Yeah, and I think people are finding something that works best for them. It kind of looks like the ascot, if you will, now, but it's just a kind of a mask that you could throw over. It's a cloth one, and obviously people are still using the low-grade surgical mask. They're still trying to recommend people not use the N95s, but but people are complying and they're doing that. So much so that hospitals now are returning back to elective surgeries. They're letting people know, please, our emergency rooms are open. Come on in. They're closing down both those facilities. The Novi facility as well as TCF. They're making plans to do that. So everything's going in the right direction. The debate is whether or not the executive orders were the things that kind of helped force the compliance with people wearing masks and everything. I don't know if that's the case. I think people truly understood the reality of the problem and they were complying because it was more of a voluntary compliance, not forced compliance. Sure, I do believe some of the essential and non-essentials, closing them down without question helped. I think, lessen that need for people to get out and move around and have that contacting, lessening the number of people that can congregate, from originally started with, 250, then went down to 50, and then it went down to 10. So I think that did have an impact on it. And getting people out of the workplace and finding alternate work, sites or environments for them helped as well. So, I tend to look at it as it's more that compliance thing and people are kind of abiding by, as opposed to, if you don't do this, you're going to get a ticket from a health department, a police department, or somebody from the state is going to be, raining down upon you for violating this. That's not what people are looking for. I think they will voluntarily comply if understanding the rules.
Rules, regulations always become an interesting conversation, Mark, because as we've talked about, individuals go to the extremes, whether they disagree with it or whether they have the differing viewpoint. I think it's those common sense approaches that have helped us not only ensure that we have safe environments where individuals can engage, whether it's the grocery store, whether it's going out to a park, whether it's the hundreds upon hundreds of county employees that have risen to the charge and continue to come into work and meet those services that are needed, and how we've developed those remote and rotational work strategies. All those things are part of those common sense approaches that we're doing day in, day out across the county, and even as individuals and businesses reach out to us for guidance as far as where they can go.
Yeah, and you see at a frustration level, people want everybody to wear some type of a mask or some type of a, if you will, face shield and keeping a certain distance and having directional signs, going into the markets and all that. I see that happening, but you also have people that are stressed on the other end of it. They don't like being told what to do. They'll comply on their own, but don't tell me I have to do this based upon some kind of an order. And just recently, we thought there was going to be some lessening, if you will, of the governor's orders. She did, once again, re-up on the stay home, stay safe order that's in place, their executive order, and that's up until May 28th. It came up simultaneously at the same time with this new, my Michigan Safe Start program, and very complex. And I say that because we've got our emergency management team, our corporation council, our human resources, people from our planning and economic development, our health department officials all coming together to look at this document to try to make sense of it. And for our own purposes, we know we're going to get questions from the public. We know we're going to get questions internally from the employees and businesses as to what does this mean. We can only give some kind of idea as to what our assessment of it is, but to get a true understanding of what the actual, plan means and order means, you're going to have to get a hold of the state to find that out. We're going to put a copy of the most recent order on our website, macombgov.org, so you can read through it, but it's very complex. And I mean, even if you look at the color-coded chart that they have here, it reminds me of back in the day when I was the sheriff, and we had the tragic situation here with 911. And when we were attacked on our homeland here, Homeland Security came up with a color-coded guideline that was extremely confusing to the public. It really wasn't something that was easy for them to accept and understand, and even those of us in law enforcement had a hard time understanding it. So I'm looking at this guideline and I'm kind of going through the same process in my mind, thinking, how do we get people to understand this and how do we relate this to them? Suffice it to say, I think the simplest thing is continue doing what you're doing. And basically following those CDC guidelines and recommendations about if you're close to somebody, put a mask on, keep that social distancing. If you can stay home, stay home. I'm just not one of those that, let's force this upon people and issue violations if they're, not following the rule, I guess, if you will.
Mark, there's been a tremendous amount of information that the state of Michigan has developed, not only to provide people with guidelines and provide people with a perspective of how this virus may impact them. Whether it's a color-coded chart, whether it's a 17-page executive order, all these things are going to be vetted by experts across the state of Michigan and even here in this county. What it boils down to is, again, using that personal responsibility, but also as new data comes out, as new perspectives come into the equation, how we can use that to engage, interact with one another again, and get back to where we were with some degree of normalcy, and again, that compliance and individuals feeling safe in the environments that they enter.
And Bill Riddell from our health department, Dr. Lokar, what they're trying to do is give us the guidance as to the health aspect of this, making sure we understand, the health and safety, where we're at right now, as a community, as a county, and, looking at some of the state guidelines to balance it out. What is the health factor? We understand about the economic perspective and people's emotional health because of being, forced to stay at home, not working, the unemployment issues, all that stuff balancing out. I guess the next wave of this isn't so much to try to figure out how do we flatten the curve and lessen the pressure on hospitals. It's now try to figure out how do we prevent some type of resurgence. And so with that, there's a question as to how far should we go. The governor has opened up, a few other, I guess if you will, business practices.
Absolutely.
So they can kind of get back to work. And, yet at the same time, kind of came up with more restrictions on the must aspect of what these guidelines are from the CDC. So, some of the businesses that we're allowing are...
Two of the biggest litmus tests that we see here coming up over the next 2 weeks are seeing how this impacts with construction coming back online, both residential and commercial, and then also on Monday with manufacturing open up. There's a number of different restrictions that have been put in place with regards to manufacturing as far as those distancing elements, some of those facial covering requirements. Those are things that each workplace will have to assess, not only from a risk assessment perspective, but also from a compliance and a regulation perspective. You brought up the whole notion of other regulatory agencies, whether it's MIOSHA, those types of things. Safety in the workplace becomes the key conversation of that right now.
Yeah, and let's face it. You've got folks that basically businesses want to keep their employees safe, as well as people that are coming to their facilities. So they're going to put requirements in place. And so this forced aspect of it, I think, is one thing. But I think just give people the opportunity to understand that they're going to comply. And I think that's the thing we need to somehow rely upon.
Mark, it's interesting too with manufacturing here in the county. 1,600 manufacturers employ over 70,000 individuals. This is going to be a major barometer for how this virus will continue to interact with the public, what it means as far as safety for our residents, and more importantly, how we get that economic well-being back into our system here in Macomb County.
Yeah. So again, please look at macombgov.org. You're going to find, as JP mentioned, about the construction. There's a complete list of the road projects here in Macomb County. There's an icon, macombgov.org. Click on that icon. It'll give you, in fact, you talk about a very robust, easy to access, easy to understand. You just click on a map and where the road project is going to be, or bridge project, and it'll tell you the information as to when it's about to start, the cost associated with it, and when we determine or what we believe to be the end date of those projects as well. So again, we want to continue to try to keep you as informed as we can. We know Sunday is Mother's Day, and we want to wish all of you, those that are mothers specifically, a happy Mother's Day. And again, from JP and myself, we want to also make sure that you stay home and stay safe.